Remember, Mondays are always lower because of how reports come in. 2,619 new cases in a 3-day period, in a weekend. This is as rough as it gets. And then Saturday, 13 new deaths. Sunday, 18 new deaths. And today, 25 new deaths. These were the type of numbers that we hope to never see again. And positivity rate continuing to increase, now at 13.45%. The only reason it hasn't jumped much higher is we have significantly more people getting tested right now, which is a good thing. But that denominator gets bigger, and it is harder for that rate to rise. But it still says, with this much more testing, that there is a lot of disease out there. Hospitalizations, we're now at a new all-time high, 2,000. I'll get to that in a minute. 2,198 Kentuckians in the hospital battling COVID. That means this is as full as we have ever been. 615 Kentuckians, a record in the ICU fighting for their lives, and a record 361 Kentuckians whose families are praying for their survival on a ventilator now battling COVID. I think it's really important for people to know that the incident rate, in other words, which group is getting COVID at the highest rates, has been the highest in ages 10 to 19 for months. In other words, if you are ages 10 to 19 right now, you are getting COVID at a much higher rate than any other part of our population. These are our school-age children. You look at ages of the deaths. People are passing away, and it's hitting everybody. It's everybody from a 77-year-old woman in Breathitt County to a 34-year-old man in Davis County, died on August 8th. It's at least the second, I believe, 30-year-old from that county. To the 52-year-old man from Nicholas County, to the 46-year-old man in Hardin County that died on the 19th. Again, this is hitting people of all age groups and making everybody sicker. We're also seeing how quickly that this surge is escalating. Let's look at our stair-stepper chart. Last week, highest week we've ever had in the course of this pandemic. And I say this each time. This isn't just tragic because of how much real sickness, long-term health effects, and death are going to follow it. Remember, that comes several weeks after. But it's also tragic because this is preventable. This is the one time in this pandemic when we are faced with the surge going up, and we could stop it simply by everybody getting vaccinated tomorrow. Yet we are on the most significant surge that we have seen. This tragedy can be stopped by something as simple as everybody making a good decision, walking down to their Walgreens or CVS, their independent pharmacy, their Kroger, their grocery store, their local health department, and just getting a shot to save humanity, to save Kentuckians. As we look at the rate of growth, which we have done each time, what we see, Jim, if you can go to the next one, is at this point we're in exponential growth. This is what we always wanted to avoid. Philadelphia versus St. Louis, we're seeing Philadelphia right now. Remember the impact, the devastation there, so much greater than when you can flatten and push down that curve. And you know what? It's not any different right now than it was earlier, except that we have extra tools, right? We had things like social distancing and masking, which before was our most effective tool. Now we have vaccines, even more effective than masking, meaning we can stop an exponential growth, but we have to have the will. Positivity rate, again, continuing to increase. This is the highest level since we had enough testing, and now we have a lot of testing. Again, we've gone from what we were doing tests per month, several months ago, to doing that per week right now. We're scrambling to get more and more testing built back up. That is going very well. But the fact that this is still increasing when there are that many more tests out there, when there's this much contact tracing, especially around schools and families, and thus people are going out and getting tested, the fact that this is still increasing says we don't know where the peak is going to be yet. And we ought to be concerned about that. I, of course, believe that we will find the peak when we force it. When we force it by masking, when we force it by vaccinations. So if we'll look at the week over week, COVID-19 test positivity rate increase since we started this increase. What you can see is it's actually getting a little less steep now, but that is more of a function, once again, of more testing, which is a really good thing. And everybody out there, you need to get tested regularly at this point. I mean, this is the fastest growing thing we've seen. It is aggressive. Even if you're not symptomatic, even if you haven't had exposure, you ought to be tested regularly at this point, because if you're like me and you're vaccinated, you could be carrying this thing and not even know it, and you could expose your unvaccinated child. I live in that world. So getting tested regularly is something you can do to protect your family. Were we able to get line graphs of hospitalizations, ICU, and ventilators? All right, we'll come back to that. Let's move to the rate of COVID-19 cases and vaccinations. This chart has always been about how much more protection you get if you are vaccinated than if you are not. With the Delta variant being more aggressive than, say, the Alpha variant, which we were probably dealing with primarily in March, yes, we're going to have more breakthrough cases, but look at how many more cases there are overall. What this chart shows you is in Kentucky, even with more breakthrough cases, you are more protected by getting vaccinated now than you even were in March. In March, if you look at these numbers, you were 4 times safer if you'd gotten vaccinated versus if you were unvaccinated. Today, if you look at the end of August, you are 5.8 times safer if you have gotten vaccinated than if you haven't. What that means is you're living in the most dangerous times of this pandemic, and the vaccines are holding up. They're giving more protection than ever. And remember, this is just cases. Hospitalizations, et cetera, much less likely to get really sick. Let's look at that. If we go back from March, and that's that time that really fighting the Alpha variant, if we can go to the next one, into when what we saw was the Delta variant, still the numbers are very clear that while we do have vaccinated folks that are getting this virus, and we need to know it, we need to wear a mask, we need to help prevent the spread, and we do have vaccinated individuals like Representative Brent Yance that have passed away, haven't done it all right, that this surge is being driven by the unvaccinated. And the more unvaccinated individuals, even the more potential infection of vaccinated individuals. But just look at this, 90% of all our cases from March 1st, 91% of all of our hospitalizations since March 1st, and 87% of all of our deaths since March 1st have been with unvaccinated individuals. And in fact, these numbers fluctuate a little bit, but we're seeing them hold up really strongly, showing that getting vaccinated protects you. I want to compare a year ago with where we are now. You know, in August, a year ago, we were still dealing with COVID. It was serious, but in many ways it pales in comparison to where we are now. Let's show total cases August 2020. This is just, don't worry about the August 20th. This is actually August of the year 2020 versus August of the year 2021. August of 2020, we had 19,903 cases, and that felt like a ton. That worried us. This August, we had 77,089 cases, 3.89 times more. Next slide I'm going to show you, though, shows you how much the rate of growth is in kids as a comparison. And remember, you may hear different numbers, but there are a lot less people under 18 years old than people over 18 years old living in the Commonwealth. So let's look at the next one. Yeah. As a dad, this one hurts. August of last year, we had 2,352 kids test positive, and that was far too many for my liking. This August, we had 18,909. That is 8 times more. More kids are getting COVID right now than we ever thought imaginable. Just look at the percentage of overall cases. In August of 2020, now go to the pie chart. In August of 2020, kids made up just 11.8% of all cases. Today, it's almost a quarter. Folks, this is hitting absolutely everybody. And the level of cases are overrunning our hospitals. St. Clair being one of the hardest hit. We'll talk for a minute here in a second about what we're doing to help. Already setting up additional tent space, just like Pikeville Medical has, to either triage or to house patients. We are living in a reality where some COVID patients that are sick are being treated in their cars when there isn't room for them inside the ER or in the hospital. As of today, now 58 of our 96 hospitals are reporting critical staffing shortages. Remember what? Just last week, that was a third, and we're well over a half now. Today, we think we only have 115 adult ICU beds left. That was 219 on Friday. Shows you how fast that can change. As of today, we have 21 kids confirmed in the hospital. That was 11 on Friday. We have 7 in an ICU. That's up from 5 on Friday. On Friday, we had 4 kids on ventilators because of COVID. Now we have 3. I pray that is for a good reason. Around the state, different hospitals getting hit, dealing with sicker patients than they'd ever seen before. Advent Health Manchester needed more ventilators. Isn't that an awful thing if you're a hospital to need more ventilators? The state has been able to help. Barberville, ARH, working really hard, but having to accept patients from other places to ease their surge. 4 patients on ventilators in a full ICU. They had to wait 2.5 weeks to transfer one patient they had that needed to go to another facility, but they are there absolutely fighting. TJ Sampson, we mentioned on Friday briefly, had to request more ventilators. So let's remember that this isn't just hospitals filled to the seams, which they are, and people running out of space like Pikeville, and ARH Hazard is having a tough time. Baptist Hardin hit really hard, and so many more. It's also people being treated at hospitals that are sicker than those hospitals are ever used to taking care of, and not having space oftentimes to send them to another facility. So today, to talk about their experience at Baptist Health Corbin, we have Sherry Mays. We're honored to have Sherry, Vice President and Chief Nursing Officer for Baptist Health Corbin. Sherry's been with the hospital for 38 years, and she stated she'd never seen anything like this before in regards to the COVID crisis. Thank you, Sherry, for joining us today to give a firsthand account of what you all are seeing. And as you're on the way up, let me say thank you. On behalf of all Kentuckians, thank you, and thank you. This is a very dark time, and you and your coworkers are our beacon of hope.
Thank you, Governor, for having me today. Just wanted to share something about our situation in southeastern Kentucky. We have 4 small hospitals in that area, and 2 of us are bigger than some of the others, but we are all overwhelmed at this time. Share our specific situation at Baptist Health Corbin. This morning when we came in, we had a census of 175. all of our ICU beds, our PCU beds, our telemetry beds, our med-surg beds are all full. We have no more capacity in those beds. And we've made the decision to close our surgery department to allow us some extra space down there should it be needed, and utilize that staff to care for patients as well. Currently, we have 65 COVID patients with 14 of them on ventilators. Only 6 of them have been fully vaccinated. None of the others have been vaccinated. And talking about ventilators, we have 14 in use. We have 10 more available, and we've ordered 5 more in case we should need them. We're seeing more positive obstetric patients during this surge, which means that we have to take care of those babies require additional assistance and care, as well as the mothers. And we're also seeing a younger age group as well. The 20 to 60-year-olds are really sick this time, and many of them are ventilated. And as the governor said earlier, we have lost some as well in the earlier ages. We've opened additional 6 CCU beds to accommodate the patients that are ventilated. And as of today, we are taking care of those patients, and we're looking at expanding that again. We've also opened our monoclonal therapy clinic 5 days a week. We were actually doing 5 days a week, and just from like 6 a.m. to 10 a.m. We've now expanded that from 8 to 4:30 to accommodate those patients. And we're seeing 30 to 40 of those patients a day, which keeps them out of our ER, hopefully, and keeps them out of the hospital as inpatients. Wild Health Testing Center, we opened that this past weekend, and it's actually opened on our campus. And I know within 2 hours of it being open the other morning, we had already tested 25 people. I don't know how many they've tested today. We have a 28-bed ED unit, and we're seeing 150 to 170 patients a day right now through our 28-bed ED unit. So, we've extended our staff, trying to pull additional staff in. We've done all kinds of creative things with our staff to ensure that our patients get the care that they need. And the other thing I would like to ask is please get your vaccination. That's the one thing you can do for our community. And the other thing, the other thing that you can actually do for our community is pray for our patients and pray for our staff and our physicians that they'll be resilient during this pandemic and that we can get through it as quickly as possible, because our patients are really sick. And until you've really experienced what's going on in the hospitals and the devastation that our staff see, it's very difficult on our nurses. And we actually provide therapy services for our nurses to ensure that they're capable and feel functional, that they can take care of our patients. So thank you all for having me. I appreciate it.
And Sherry, I get emotional just about every one of these I do. So no, I thank you for hopefully making this real for everybody out there. And we do not appreciate enough the trauma that our healthcare providers are going through. We talk about trauma a lot in times of war because of experiencing death and seeing death. That's exactly what all of our healthcare heroes are doing right now at a degree they never, ever thought they'd have to. So again, I'll talk about Healthcare Heroes Appreciation Week in a minute, but this is so, so important. I want to talk just a minute, while I might not have all the authority or powers that I may have had a little over 10 or 11 days ago, I still have the ability to do everything I can to help these facilities. So we're taking some actions to help hospitals, one of which Sherry mentioned first. I think it's in 2 days or a day that the National Guard will be at numerous hospitals, including Baptist Health Corbin. Their goal is to do as much logistics, as much administration, to free up as much clinical staff as possible. It's also going to help when others are out because of COVID. They can take over food service, and these are phenomenal, hardworking people, and I hope they lift the morale too. We've got 3 FEMA EMS strike teams that arrived on Friday to help with patient transport. They are in 3 different places. I believe it's Somerset, Prestonsburg, and Louisville. And here's how important that is. This weekend on Saturday, Twin Lakes in Litchfield had the power go out. That's a hospital in the middle of COVID. Had their power totally go out. Transformer blew. Eventually, the decision was made, and oh my goodness, this is part of Owensboro Health, and they did an incredible job that they were going to have to evacuate most of the patients there. We had that one of the Louisville FEMA team on standby to go and to help with that. Turns out they were able to handle it all in what they had, which is an incredible testament. But these are the types of things that these strike teams can step in and help with at a moment notice. We've also requested nursing strike teams that is not up here. We're getting preliminary word that we may get at least one of these. It would be incredibly helpful. The facilities are having to talk directly to FEMA now in the midst of that process. Sherry mentioned providing COVID-19 testing assistance to some Kentucky hospitals. Hardest hit places, we're sending in our private contractors that we've worked with, take over that testing, free up more staff to do other things, and push people away from the emergency room. Whether they're there because they're symptomatic and need the test first, or whether they're there because their kid's got a baseball tournament in the upcoming weekend and they came to the emergency room to get them tested. Don't go to the emergency room to get a regular and routine test. You do not want to do that, and it does not help your neighbors and your friends. And here's something we're working on right now, and that's sending nursing students to help staff area hospitals in need of support. I want to send a shout out to Galen. Was talking to some of their folks this weekend, and we believe we're going to be able to mobilize a lot of help to a lot of hospitals. This is what we do in times of need. We got calls into other nursing schools. We will take as much help as possible, and I know that you all can put them to good use. Just a couple details of some of those that I missed. The EMS service is 30 personnel, 15 life support ambulances that are here. They're going to be here for at least 30 days and possibly beyond. We've asked for 2 more EMS strike teams as well. And then remember, we asked for up to 100 nurses and administrators for the nursing strike teams. We are not going to get all of those in the short term. I think we're going to get 1. And when we have more details on that, I hope that we can get 2 to 3 because our situation continues to get more dire. Want to thank Wild Health, UK Healthcare, Gravity Diagnostics. Those are the teams that have come in right now to help in testing. Gravity Diagnostics stepping up again, and Wild Health been there as well. We appreciate all that work, and just to lift up those working in our hospitals, knowing how critical it is that we keep all that staff right there. Last week, the Lieutenant Governor and I tried to do our part to build morale, stopping at hospitals, health departments, and clinics in the Commonwealth to thank our healthcare heroes, to thank them who are working to keep our people safe. I wanted to personally thank them during this pandemic for showing up each and every day, knowing the trauma they go through, but thanking them for that heroic work. It has been a long, stressful, exhausting 18 months for all of us, but none more than these healthcare heroes. We have asked so much, and they've answered the call. I want to thank others who answered the call, though, because we asked for others in the community to do it. The Henderson Rotary Club delivered 561 meals to Deaconess Henderson and Henderson County Health Department to celebrate Healthcare Heroes Week. Blaze Pizza at the Summit at Fritz Farm was offering major discounts for healthcare workers. Local leaders in Barron County visited hospitals in their region and did a countywide proclamation. University of Kentucky College of Health Sciences collected snack donations for our frontline workers, and students sent notes of encouragement to local nursing homes like Masonic Homes of Kentucky. And let's do remember, those working in our nursing homes are healthcare heroes too, that have seen far too much trauma as well and need our help to lift them up. But I think what Sherry said is the absolute truth. Do you want to know the one thing you can do to help that person who cared for your family member, that gave you the test when you were scared, that called to tell you what you needed to do to monitor your symptoms, that was that voice when you didn't know what the next day would bring? Get vaccinated. It's that simple. Get vaccinated. So next up is Dr. Jeffrey Fox. In March of 2020, Dr. Fox, a family medicine doctor at Baptist Health Lexington, was battling for his life against COVID-19. After a month in the hospital, including 3 weeks on a ventilator, Dr. Fox thankfully survived. In April of 2020, we shared his story during one of these press conferences. Now, more than a year later, I'm so glad that he is here to talk about his experience. Dr. Fox, you gave us hope. You gave us a reason to celebrate, and I am so glad you're here with us today.
Thank you, Governor, for giving the opportunity to share my story. Like he said, I'm a family physician, Family Practice Associates of Lexington, and in March of 2020, I was one of the first people to contract COVID. Initially I thought it was just the flu, and I was hoping it was just the flu, but things progressed, and I ended up comatose on a ventilator for 3 weeks. I spent a month in the intensive care unit, but I survived. It took several months of rehab to get back to some semblance of normal, and I still have some residual effects. But because of a lot of prayers and a lot of great care from physicians and nurses at Baptist Health, I survived. I don't want what happened to me to happen to you. When I got sick, we only had a few masks to protect us. We had limited PPE, we had limited testing, we had no idea how to treat the disease. We had no vaccines. But things have changed since then. We can mitigate the disease. We can protect ourselves. We can protect our family and friends. We can protect our coworkers. Please, please get the vaccine. Healthcare workers, you've heard them day in and day out. They are a resilient bunch of people. But we are tired, and we are frustrated, and we are sad. Give us a break. Get the vaccine. I've been taking care of patients for 40-something years, and I've never once told a patient to do something that I thought would hurt them. The vaccine is safe and effective. Talk to your family doctor. Talk to your trusted healthcare provider, not social media. Please get the vaccine. I know what it's like to almost die from COVID, and I know personally what it's like to take that disease home and give it to a family member. I see fears in the eyes of my patient when I tell them that they have COVID. And we have all seen too many people die with COVID. I also see patients who have COVID who are vaccinated, but have no symptoms. Please, please get the vaccine. The people of Kentucky are good people. If you have gotten the vaccine, thank you. If you are thinking about getting the vaccine, thank you for consideration. If you don't want the vaccine for yourself, get it for someone that you love. It's not a political issue. It's a public health issue. It's not about individual liberty. It's about individual responsibility. Please love your neighbor as you love yourself. Wear your mask when appropriate. Watch your social distancing. Wash your hands. Please get vaccinated. Thank you, Governor.
It's those same healthcare heroes that made sure that Dr. Fox could be with us here today. We appreciate you. We appreciate them. Thank you for your powerful testimony. So last week, I met the uncle of Laura Atkins, a COVID survivor who spent more than 100 days in the hospital, a good portion of which she was sedated on a ventilator. Laura's uncle called her a miracle because today she's healthy at home with her husband and 2 children. Today, we hear from Laura via video as she graciously agreed to tell her story, because so much of this happens outside the public view. We ask people who are sick to stay in their homes so other people don't see how sick they are. And there's limited visitation in hospitals, so we don't infect more people. And so you don't see what 7,400 people dying looks like. But today we hear from Laura about the impact this virus has had on her life and the lives of her family members.
I was waiting my turn for the vaccine in January when that, in spite of our small circle and lots of care taken, my 2 kids, my husband and I tested positive for COVID-19. Within a couple of weeks, I was on a ventilator. I stayed in the hospital during that stay for over 100 days. I was sedated and missed my daughter's 9th birthday, my son's 4th birthday, my 17th wedding anniversary. I missed my mom's birthday. I missed these major milestones. But more than that, I missed the day-to-day with my family. I missed watching my kids grow and change and thrive for 100 days. I went through ECMO. I ended up with necrotizing pneumonia, cryptogenic pneumonia, ARDS. I went through a lot. And even after I finally came home, I went through months of physical therapy. Only recently I've been able to stop using a walker to get around. But I was diagnosed in January. Things were different. In January, I was waiting my turn for the vaccine. Now the vaccine's readily available. And it's a choice. But to me, that choice is simple, because God saved me. I have no doubt. There were medical professionals who told me after the fact that there were days that when they went home after their shift, they didn't think I would be there the next day. But there were lots of prayers, and it wasn't my time, and God intervened. But God's done more than just that in my case. God gave the scientists and the researchers and the doctors the knowledge and the skill to develop this vaccine. And now he's given you free will. He's given all of us free will. And he's told us, Jesus said, that he gave us a new command. And that command was to love one another like he loved us. Like he loved us. Jesus had a sacrificial love. Jesus sacrificed his life for ours. And if that's the kind of love that we're supposed to show one another, then we can get a shot. If Jesus could hang on a cross and die for us, and God could give the knowledge and the skill to these scientists and these researchers and these doctors, and just create this miraculous vaccine, the least we can do is take it.
Amen. We focus a lot on the deaths caused by COVID, and rightfully so. Death is really painful to the family around that individual. It's painful to the community. It is, in many ways, the most profound loss, right, you can experience. And to those who, again, haven't gotten vaccinated yet, if you haven't lost someone due to COVID, just think about the last person that you loved that you lost, because that feels the same to that other family out there that loses someone to COVID. I've lost a close family member to COVID, but I've lost 2 aunts in months, right? And it hurts. Every other family that's losing somebody right now, 6 or 7 over the last 3 days, they all hurt the way that you hurt when someone passed away. And you can prevent that hurt. I mean, remember it, feel it. You can prevent that from somebody else. That's a special thing that you can do for other people, for humanity. And we just need you to get a shot. Right? Actually, we need you to probably get 2 and maybe a third 8 months after the second one. And you can help other people out there not feel that. And don't you think our nurses and our doctors have held enough hands of folks who have passed away that we could stop? What about their trauma? Or if it needs to be even closer, if you're in a car wreck today, we might not be able to get to you. So if you'd like to make sure that ER is open for you, if it has to just be about you, then I need you to get the shot to make sure that our healthcare heroes can help you. What I also need is to make sure as we move forward that every school district and every public and private school universally mask all staff and students. We have seen school districts get hit and hit hard. Those that have not masked all around the country get hit by far the hardest. And we have seen, even when you mask, this thing is so aggressive, it can be tough, but the differences are night and day. And let's get beyond the myth that this doesn't spread in schools. And we all try to say, well, they brought it in from somewhere else. Well, listen, somebody can bring it in from somewhere else, but if we're not masking, they're going to spread it all over there. And I can tell you from having talked to schools, they do the contact tracing and people are testing positive. And now we're losing people again. Remember, it started with Fayette County losing bus drivers, and we lost a student in Western Kentucky, loved by their community. And then we just lost an elementary aide in Lee County. And that's one of 4 different individuals that are in the hospital. We thank her for her service as an educator, and we grieve with her family. This is not supposed to happen. And if we work hard and more people get vaccinated, we can prevent this from happening. And listen, schools are already facing such challenges. I think it's now, since we just showed the Herald, we'll show 18 school districts now having closed due to COVID-19 at least once this year. This is, I think, the best count. I mean, this is hard. And without masking, it's impossible. Absolutely impossible. And I know we say that choices can be tough or politics can be difficult about it. There is no choice here. There is science and there is fact, and it's clear. If you want it to work and you want your kids in school, they got to be wearing a mask. If you want your kids to go to the world's giant chickenpox party with the 3rd leading cause of death, and then to be home doing NTI because so many people got COVID, that's what happens everywhere when you don't mask. I'm not trying to be flippant. It's just night and day. It's fact, and then it's trying to believe in fiction. This is a tool we desperately need. And how many kids do we want to endanger? And I'm using that word intentionally if we don't do the right thing. If you're in a school right now that's not masking, listen, you may have the loudest parents who otherwise would show up and yell at a school board meeting happy. But when school's out, for how long? Or worse, something happens to one of your educators, it's going to be a lot worse then. So please, if it's a decision, make the right decision. And there is only one right decision. And again, that might not be popular, but I'm way beyond that at this point. This is about the protection of your kids and mine Remember, I have an unvaccinated child, too young to be vaccinated, and one that is vaccinated. This is what we have to do. Speaking of vaccines, that's exactly where we have to go to get out of this. Over the last 3 days, 27,505 new Kentuckians vaccinated. That brings us to 2,524,083. It's a good number. It's less than those 3 days last week. Let's continue to do better. So we look at this both demographically, by age, and then we look at it geographically. I will tell you the demographically looks better than the geographically today. So we're up 1% on adults, now 68% of folks 18 years and older. And listen, I mean, this is better than just about any other state with our makeup, but it ain't enough. You know, the virus doesn't care about our backgrounds or our politics or any of the rest. It's out there to kill as many of us as possible. So we got to do better than anybody else if we want to protect our people. 65 and up, still the same. It's harder to move from 85%. But remember, these are the most vulnerable. 15% of them have not been vaccinated. We have to do better there. 50 to 64, up 1% to 71. Please keep going. 40 to 49, up 1% to 58, but a lot of room for improvement there. 30 to 39 years, up 1% to 53. 18 to 29, up 2%. Now, I will say, I think next week we're going to be able to transition to the new census numbers. So these percentages are going to change a little bit because they're going to give us a new denominator to look at the number of people in those age groups. We will then be able to get 12 to 17 and give a very accurate all eligible Kentuckians number. I'm also told that some of the unknowns right now in our system, they can assign an age to based on what the federal Tiberius system is doing. So we'll have more updates on that as we go. But I'm just expect this to change as we change from which census that we are using. Okay, so geographically, you know, we look at counties with 40% vaccinated. No change in that. We need a lot more counties that have 40+% of their population vaccinated. We do have one change in the 50% or more vaccinated. McCracken County, congratulations for continuing to work and getting over this threshold. Keep going. You have 50% more of your population, just like everybody else has more that is out there. Please keep working. Today, and this, you know, could change because of testing. Today, every county but Woodford County, I believe, is red. And Woodford County is the most vaccinated county by first dose. If we had enough testing everywhere, I think you would see that the incident rates would always be smaller in the counties that have the higher vaccinations. So the best way to protect yourself and your community is to get vaccinated. So today, we got a couple additional healthcare heroes via video to try to encourage you. TJ Sampson, hit harder than they have ever seen by video, is joining us with Tara Jeanette, a clinical staff pharmacist, Dennis Pitcock, physical therapist, and Bill Kindred, former chief executive officer there, to explain via video message why they chose to get a safe and effective vaccine. Let's follow their lead.
Working in the hospital system, you see the effects of COVID, and we've had many patients that came through, and you see how devastating the disease can be.
I had a rather long and difficult time with COVID. I was in the hospital for 3.5 months, and a month of that time I was on the ventilator. Recovery was difficult. If I could have avoided that, I definitely would have. And what was probably just as bad is what I put my family through during that period of time. I about died 3 times. Getting the vaccine, if it can prevent you from going through what I did and what I put my family through, it's a small price to pay.
If I could prevent someone I loved from getting sick or having a bad outcome from COVID, and if getting a vaccine or wearing a mask is something you could do to help prevent someone you love from getting sick, then I believe that's a good thing to do.
The best way to protect you and your family.
The best way to protect yourself and your family
The best way to protect yourself and your family is to get vaccinated.
is to get vaccinated.
Is to get the vaccine.
So please get the vaccine. You know, we were waiting. We have the overall numbers today's report. There are 5 people of the 25 that died that are on today's report that are younger than I am. 5. 4 in their 30s. Didn't get to live to see their 40th birthday. And again, 10 to 19-year-olds at what? 4 times higher rate than those 80 plus. That's all about vaccinations. All right, with that, we'll open it up to questions. We've got a couple folks that are here. We've got some that are virtual. We'll start with chat.
Governor, I noticed today we did reach the 2.5 million mark for vaccinations. This is a goal that you set back in April and estimated that it would take 4 to 6 weeks to reach that number. Your reaction to finally reaching that and thoughts of it taking as long as it did?
Well, reaching 2.5 million Kentuckians having at least one shot of hope when you look at what about 4.4 million people total in the state, and folks under 12 not being able to get vaccinated is a point that I'm proud we reached, but it's really bittersweet. If we'd reached 2.5 million when we wanted to, when we had it out there, then we might be in a very different place now. Having that much of our population vaccinated earlier, we might not be seeing this devastation. But just like then, now the answer is just to get vaccinated. I think that there are things we learn all throughout this. We learned about the incredible empathy and generosity we saw from people, the incredible resiliency of our healthcare heroes. We've learned some other things too about how misinformation can spread and kill people and lead people to do things that, we could have never imagined. I grew up with horses. My brother is an equine vet, and every doctor in America is saying, please get vaccinated. And somebody on Facebook says to take a deworming medication, and people run out to do it. That's scary. And please, God, don't do that. If you've ever taken care of horses, they are much, much, much bigger than us. And their bodies work very differently than us. Remember, if you're thinking about taking horse medication, they don't have arms, right? They're entirely different than you and I are. And again, you got a vaccine that's full FDA approval. You got people taking deworming medication. So more important now than ever to get factual information. I'm not sure the question had anything to do with that, but apparently I was going there. Tom.
Thanks, Governor. I keep hearing that you're going to call a special session begin next Tuesday. Is that indeed the case to deal with all this? Is that the case? What all will be on the call?
My goal is to call a special session as soon as legislative leaders have reached a general consensus about what they think can be done, and we're able to talk about that. And I'm sure I will push for some other things as well. It needs to happen soon, and it probably needs to happen before the state of emergency might, in and of itself, go away, if nothing else, because of what we're seeing in schools. Schools right now that have to shut down because of COVID should be going to NTI days, right? They should be able to continue that learning and not halt that progress, as long as their staff, which has been hit hard, isn't sick, right? There'll be opportunity, there'll be potentials where that can't happen. And additional flexibility and everything from being able to having more NTI days to being able to use it on an individual school, for instance. And right now it has to be on an entire system. With this many schools that have had to pause, they need more tools and more options. And I'm not trying to put the 10-day limit negatively on the legislature. We're in a different place, but it's got to change now. It's got to change quickly. I'm gonna seek all the tools that I can. I'm not going to hold off on calling a special session if I don't get all of them, because listen, if there are 8 tools to fight COVID and 2 are critical, and I can only get one of them, but I get all the other tools too, listen, that's better than fighting with nothing. Now, if it doesn't include masking in schools, our kids suffer. If it doesn't include the ability to have a statewide order, then just know we're going to have more cases and we're going to have more bad outcomes. That's just the science of it. But we've had ongoing conversations. I'm not to a point where I can say there's a certain day that we've agreed to, but as soon as possible. Drew.
Two quick questions. One, the New Hampshire governor you met with,
Mhm.
along with some health officials, can you share anything about your visit, takeaways that you got from him, what you offered to the governor? And with hospitalizations the way they are we getting any closer to revisiting the field hospitals?
So first, Governor Sununu was here to see what we're going through. We're getting hit hard. He knows it's coming everywhere else. It's coming everywhere else. And we got to have a real frank conversation. Everything we talk about, if we could go back in time, what we might do a little bit differently, where they'll see things. One example is, our regional hospitals oftentimes have twice as many COVID patients as they did before. Our urban hospitals don't quite have that yet. It probably has to do with vaccination rates, but moving around equipment earlier. Now we're able to keep up, but that's one thing. How do we go ahead and bolster the ability to transfer patients? How do you, if you know you have time before it's coming, how do you try to increase ICU space, especially where it's small? If you're Ephraim McDowell, how do you increase your morgue space? I mean, those are all the types of things. And listen, I'm gonna give him credit. He's trying to think ahead and do as much ahead as he can. Second question was field hospital. Here's why the field hospital isn't feasible right now. Our challenge isn't beds. That's what the field hospital does. It adds beds. Our challenge is staff, doctors and nurses. So the field hospital was going to be staffed at a time when there was more staffing by the National Guard. But every single one of those medical personnel work at a hospital or a medical practice somewhere around Kentucky. So because we have more beds in places, but we don't have enough people to tend to them, the field hospital doesn't solve the issue. If we had an influx of additional doctors, nurses, et cetera, then that's something that we would look at. But our goal right now is to increase staffing. Thus the testing, add some nursing students to testing, and we free up the more trained clinicians. So it's truly our staffing instead of physical beds. Put up an ICU, right? And not the level. That's when we look at physical. Okay, virtually we have Karen.
Good afternoon, Governor. Governor, with the number of COVID cases rising and increase of MIS-C cases,
we'll need to. I don't get as many reports. Seeing is kids are sicker. Every where they were with the original strain or the alpha. Kids that wouldn't have had any symptoms at all have symptoms. Kids who would have had symptoms earlier. Kids in a pediatric, hospitalized is a big, some kids in hospitals that don't have pediatric, that we have all of those count. It would be logical with a virus that's more aggressive. Some more long myocarditis if more kids get it, even. But just look at how we always kids suffer from. Well, if we go back and look at the change in the when people were making those arguments versus now, night and day. Last August, 2,352 kids 18,909. Chances for bad outcomes are higher now for our kids than ever before. Debbie Yetter.
Well, Governor, I know that we've had a couple of major events in the state where a lot of masks haven't been in evidence. The state fair was among them, and then more recently, the music festival in Lexington. And I believe there was a rally at the Capitol where masks were not in sight. Even though most of that was outdoors, do you have concerns about the spread of COVID given the environment?
So I have concerns of any indoor event outside of your home, no matter how many people, if you're not wearing masks. That's where we are. You know, yes, I can't put in a masking order, but the risk is the same. I mean, we all thought we should be wearing masks indoors when it wasn't spreading this quickly, when the positivity rate was lower than it is. And we probably have a disconnect now due to COVID fatigue where, you know, I go into places where previously everybody would have been wearing them, and they're not. But for our own safety and the safety around us, I think it's really important to get back to that. Outdoor events, obviously a lot safer, but really big outdoor events, you want to think about the space with people around you. And if you can't distance, you know, put that mask back on. I've worn masks at some outdoor events I've been at. I haven't at others. It typically is the amount of space between myself and others. But big indoor events, you have to enforce masking. We did that before. You look at even outdoor events when we were holding big ones. Everything from Louisville FC that did a really good job to all of our universities at their events. I know they did it at different capacities, but they did a really good job. We got to have the same effort, and certainly something on state property, there ought to have been a real effort for. Melissa Patrick, Kentucky Health News.
Hi, Governor. So would you, just talking about universal school masking, would you be okay with if the legislature sets parameters around when schools should do universal masking? And if so, what should those parameters be?
Listen, the answer here is it's 119 out of 120 counties are in red. And so I don't think that there's any question that a red zone county needs to mask. The challenge is we see how it spreads in schools. So if a school is, let's say, in the green zone and they say you don't have to wear masks, COVID's going to spread and you're not going to be in the green zone anymore. But listen, I'm realistic. Even though I think that there is only, I know there is only one right answer to this. If they won't do universal masking, but they say we will establish a metric by which if you hit a certain point, you have to. And if you're under that, you still can. That's the best we can get. I'll take it, and we'll do the very best that we can from there to try to continue to educate. It's a real challenge when you push down a decision like this, and some people say they want to make it to a group that then, 10 angry people can shout at and threaten and bully their way into a bad decision being made. I'm thankfully in a position where that doesn't bother me. It doesn't bother me anymore, and I'm well protected. But that's different when you move it to a different place. But Melissa, I'm realistic. I know I'm not going to get all the tools that I think we need, but I'll do the best I can with the best I get. Alex Akisto, Herald Leader, with our final question.
Hi, Governor. You mentioned earlier that we will find a peak basically when we force it by masking and more vaccinations. Models that you and your staff are using, when do they show Kentucky's infection curve and hospitalizations peaking? I've talked to some epidemiologists whose show for their hospitals it should be around mid-September. What do your models show?
Well, we hear about models like that. The challenge is, Florida looked like it was slowing and then took off again. And then where is it? We think So we certainly seen slowing growth in some places to our south, but then you'll see another report come out. Theoretically, we are not St. Louis, we are Philadelphia right now. And the faster you burn, then you peak and you come down, but at what devastation and what loss of human life? I think the answer is we don't know. And I know that's hard to hear. I've had to say that a lot during all this. The Delta variant isn't done with us, and it's not done with Texas and Florida. It's not done with Alabama or Mississippi. I wish I could tell people that if we just held on a certain amount of time, we'd be all right. And the answer is, if it's just time, that's not true, because we lose more people and more people get hurt. This is in our own destiny. It's just in our own destiny. Shots in arms, masks on faces. We've done it before, and I know that we can do it again. It is, it's admittedly a tough time, but we have been through tough times before. There are times before in my career where it felt, and it wasn't anything like a pandemic, that you were surrounded and you did your best every day to put on your armor, right? To step up to the front lines and to do the very best that you could in trying to help the most people. And today I found a verse from the Bible that talks about the same thing, that God equips us with his armor to try to step up and to do what's right and to fight off the forces of darkness. That's where we are. I think Dr. Fox talked about the golden rule, and isn't it interesting that what gets us out of this is simply following that commandment that we have been given, whether it's faith like it is with me or values. All we have to do is care about each other to defeat COVID, to put selflessness over selfishness, and to make sure that we are just as loud and encouraging people to do the right thing, the vast majority that want to do the right thing, as those that would say the opposite. Folks, we need you. I've talked about it a couple times. We need you. That unvaccinated friend or family member of yours is at risk. And I need you to have that uncomfortable conversation. And I'm hearing from all over Kentucky about people who have done it. And it's really that risk of losing the friendship that oftentimes convinces that other person of how genuine you are. I've had people break down saying their husband, their wife, their friend, their family member, that they could not convince finally got it done, and how relieved they were. If you haven't gotten the shot, talk to somebody who has. I mean, we've all wept tears of joy for the opportunity to get it, and going to the large vaccine clinics was a moving experience for everybody. This is a time that we need every Kentuckian to step up, knowing the rest of this country and the rest of this world depend on us caring about each other. Thank you, and we will see you on Thursday.